Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jessica Adams. In this episode, we will learn key considerations for improving PrEP uptake in young adults and adolescents, focusing on the unique needs of this patient population. Topics covered include methods to build trust between patients and providers, shared decision-making, consent and confidentiality, payment options, and strategies to improve adherence. I'm joined by Dr. Errol L, Associate Professor of Pediatrics at Johns Hopkins School of Medicine in Baltimore, Maryland, and Armonté Butler, PrEP Advocate and Associate Director of LGBTQ Health and Rights at Advocates for Youth in Washington, D.C. To find more information about our expert faculty, as well as other activities from this program, including downloadable slides, please visit the links in the show notes for this episode. Now let's get started.
Thank you all for joining us today for a conversation between a PrEP advocate and a healthcare professional on community and provider perceptions, barriers, and strategies to facilitate PrEP based on the unique needs of this patient population.
Yeah, so I think it's useful to think about an actual patient, or at least an example of a patient, a young person coming into a clinic or seeking out PrEP services in general. I think there are a lot of barriers for young people who would like to be on PrEP or who are thinking about PrEP as a tool for the HIV prevention. Many of those barriers have to do with just like not being aware or not finding a provider or having the provider that they have really have the knowledge about either how to prescribe PrEP or how to provide counseling around PrEP and other prevention strategies. So just thinking about a patient, perhaps a patient in his pediatrician's office or his pediatric provider's office, asking a question about PrEP, something they've heard about on television, or they've heard about it on a show, or they've heard about it in a magazine, and asking their pediatric provider about PrEP. There's oftentimes the provider doesn't know enough about it to be able to provide that young person with information or with those specific services. So I think that's one of the biggest barriers that young people will run into.
Yeah, and I would agree. And I think that, it's really important if the provider's unaware of the young person's unaware, is really remembering or recognizing that healthcare is a team effort and knowing that there are people that might be able to champion PrEP or its information about it that's either in your community or outside, and seeking out resources to inform yourself about it in a way that's medically accurate, but also sometimes even having a conversation with your provider or seeing if they can refer you to another provider that has some maybe more expertise or works with people in the field more related to issues around HIV.
Yeah, I think that's a great point. I think there are lots of folks who do know a lot about PrEP. There are lots of providers that know about it, and there are resources for those providers who may not feel comfortable prescribing PrEP on their own to connect with others that are in their community that are providing that service. So you're absolutely right. I completely agree with that. I think even before we get to that step, one thing that I was just thinking about is that there are so many messages around sex and sexuality in young people. And with those messages, there's a lot of stigma. There's a lot of discomfort among people in general about talking about sex, but I think there's discomfort between adolescents and adults in terms of adolescents going to adult figures like their provider on talking about their sexuality and their sexual health. And then they're oftentimes expecting their doctor to ask questions about that. But doctors are often not well trained, particular pediatric providers, in how to ask those questions and how to not be stigmatizing when asking about sex and sexuality and sexual health. So I think that's another barrier that we as a field need to work on, is making sure that we're comfortable with asking young people about their sexuality, asking them about their romantic relationships, about their sexual relationships in a way that's non-stigmatizing and that's promoting health and really focused on the health promotion of sexual health promotion of their patients.
Thank you for sharing that. I think that's very important. And as a provider, how would you go about ensuring that the young person is also involved in some of the shared decision-making around accessing PrEP?
Yeah, so I think that's a really good question. Part of having those conversations about sex and sexuality in a non-stigmatizing way, in a way that builds trust with the patient. We talk a lot about medical mistrust, but that's often putting the onus on the patient to put their trust in the provider. But we really need to be able to create trustworthy environments. And part of that is by working with patients to help them develop plans together and not giving them a plan, but actually developing that and co-creating that with the patient, really building that rapport and building that team approach alongside the patient. So one specific example, fortunately now we have a couple of different PrEP regimens that are available. And one method of shared decision-making is talking to a patient about which option would be best for them. Even take a step back and say what HIV prevention tool is best for them. But in thinking specifically about PrEP, because there's different regimens, having that conversation about what the patient prefers, what they think will work best for them in their lives, creates that shared decision-making model, which I think also builds trust and really helps to develop the therapeutic relationship with the provider.
Thank you for sharing that. And I want to go back to just the important information you just highlighted around really trustworthiness and making sure the space is trustworthy. Can you talk a bit about the importance of spaces being trustworthy and what a facility or clinic might do if they don't have all the resources?
Yeah, that's a good question also. I think there's a couple of different components to that. One is having sort of the trappings of inclusiveness. So having signs and messages and posters that are really inclusive of different types of people, different races and ethnicities, different gender and gender identities, different sexual orientations and sexualities, different languages, really being inclusive of all the people that particular clinical setting serves, and creating on the surface those images that let people know or give them a clue as to how inclusive and comprehensive and opening, accepting a place is. And then also, I think it starts with the moment the person enters the building. So in our practice, in our setting, before we started our PrEP clinic and also before we started our gender affirming care clinic, we had an entire clinic training, including the security guards at the front desk staff, the environmental services, nursing, phlebotomy, social work, some of the resource providers that are in the space that connect folks with social services, really everybody that's part of the clinic, to ensure that everyone was on the same page and was ready and available to open up the clinic in a way that was welcoming to everybody. Unfortunately, there's a lot of evidence of LGBTQ youth of color, those who live at the intersection of those identities, not feeling welcoming in clinical spaces. And so we really made an effort to ensure that people did feel comfortable and that they weren't put into situations where their identity was marginalized based on the behavior of someone within our clinical space. And I think that, it's difficult to close down a clinic to create a training like that. But I think certainly there are ways to do that on a regular daily basis to really assure that everyone is ready to be inclusive and welcoming to all patients. There are different organizations. The American Academy of Pediatrics, for instance, has posters and signs and things that you can print out and post up in your clinical space that really creates an open space and a supportive space in that way. And then I think beyond sort of the staff training and beyond those images, again, kind of just engaging with people as if they were people. I know we have really busy clinical practices and clinical services, and sometimes you may have 15 minutes with a patient and you then move on to the next patient. But I think just pausing in those moments and making sure that you're connecting with the patient or trying to connect with the patient is one way of building that trust and really treating each person as an individual.
Thank you for sharing that. And I agree. I think professional development is so important. And kind of how you've noted or outlined for us, it's not just for folks with MD, PhD, or MPH at the end of their titles, but also making sure that training is available for front desk staff and the security guard to really see the person that's walking into the environment, especially a young person. It's everyone's role to ensure that their care, safety, and trustworthiness is maintained. We've walked through a bit what it might be like to walk through the front door, which should be up in terms of the resources or flyers or posters to show youth friendliness. Now the young person is with the provider and really seeking out potentially access and PrEP. What are some considerations there?
Yeah, so I think one really important consideration is assuring the youth that this is a confidential and safe space to talk about sexual health and their sexuality. and concerns they have around that, concerns they have around their relationship, concerns they have around relationships with others in their lives. And we know that if youth, particularly when they're presenting with their parents, but if they're presenting on their parents' insurance as well, even if they're over the age of 18, we know that if we don't assure youth of their confidentiality and also let them know what the limits of confidentiality may be, that they're less likely to be comfortable opening up and talking about their sexual health. So I think that's a really key point to make. Some people have a practice of stating that up front, and I think that's a good practice. Sometimes folks become aware that a youth may be hesitant in answering a question or talking more about a particular subject. And that's often the time when you can reinforce that idea and that concept that I know that this may be difficult to talk about, and it may be something that people don't necessarily ask you about all the time, or just may be difficult to share. And I want to make you sure that you know that whatever you say in this office, in this space, is between you and me, unless you tell me something that makes me concerned about your life and safety. And really kind of reiterating that, I think sometimes helps open up the conversation when there may be some reticence there.
I agree. I think that confidentiality issues, unfortunately, vary by and depending on where young people are. Some of them vary by state the young people in, and then some of them even vary by the health department that a young person might go to. So I think those are very important considerations. Another one that I've seen from my work with young people is really thinking about payment options. What are the considerations of how people can afford PrEP, and really thinking about how to ensure that that isn't an added stress or barrier or strain to prevent a young person that might really need PrEP to really be thinking about. Outside of issues related to consent and confidentiality and or payment options, working and sitting right there with that young person in the clinic setting, are there any other considerations that might come up?
Yeah, absolutely. I just want to touch briefly on the payment options and payment issues. I think in general, we need to ensure that there's a low threshold to come in and access PrEP. And we've talked about part of the reasons why that threshold may be high is lack of provider training and knowledge about PrEP, challenges with talking with youth about their sex and sexuality. So those are things that we need to lower the barrier, lower the threshold so that adolescents can more easily access PrEP. Once they're already on PrEP, or once they've been able to access PrEP, we know that adherence is a big challenge. In the trials that were done testing the effectiveness of PrEP regimens in adolescents and young adults, the biggest challenge was maintaining adherence to that medication, and particularly after some of the initial visits were spaced out beyond a month period to the more 3-month or quarterly period. That's when youth really had difficulties with maintaining daily adherence. Now there's some regimens that don't necessarily require daily adherence, but still, like the engaging with the provider, engaging in the clinical setting, taking that medication on however regularly it needs to be taken is difficult to do for anyone, but particularly difficult for young people, particularly difficult from a prevention perspective. So really having supports around adherence is another way of lowering that threshold to starting and maintaining on PrEP. In our clinical setting, we have peer navigators that really reach out to youth who are currently taking PrEP to help support them, help them to remember to get their prescriptions refilled, help them remember to come in for their follow-up visits when we can. And the youth has consented to this, and there's a relationship with a adult, a parent likely, that they can discuss their sexuality and sexual health with, then partnering with that parent to help make sure they have another person that's in their household or in their world that can help them to remember to take their medication is also a key way of lowering that threshold.
Thank you for sharing that. And I fully agree. I think that recognizing that, we really need to do all we can to support PrEP navigators and making sure that they're at as many clinics as possible is helpful. And just with the work that I do with young people as well, we see strategies around adherence being, if someone's forgetful, folks set up buddy systems to text or remind them to take the medication. I've had young people have either providers or family members or friends send them calendar invites that are daily on their personal calendars. Some other young people have, timers on their phone of like, this is the day at 12:50. So I think there are various means to ensuring that folks are adhering to the medication. But in this case, say there's a young person you're working with and they're on PrEP, they're taking it, and then they stop adhering. Or what is the role of a provider in ensuring that the young person isn't shamed for non-adherence?
Oh, yeah, that's a super important point because it happens all the time, and people stop taking their medication, stop taking their PrEP, or they maybe are not able to take their PrEP for a lot of different reasons. And absolutely the worst thing you can do is to shame them for not taking or not being adherent to PrEP. It's a difficult thing to do, and it's not productive at all or constructive to express disappointment, or certainly not to scold them on why they weren't able to take their PrEP, but really to get an understanding of what has been challenging about it. What are the barriers? What are the things that make it difficult? Or what are the reasons people have decided to stop using PrEP? We know that there are periods of time, there are seasons of risk, if you will, where a person or patient may decide that they don't need to be on PrEP at this moment, or that right now there's too many things going on in their life for that to be the primary prevention tool or strategy that they're going to use. But if you are open to understanding that perspective and understanding where people are coming from, then they're much more likely to come back to partner with you to re-engage and to restart PrEP if that's right for them at that time. If you're going to be really strict about, say, not refilling a prescription after 30 days or after 90 days because the patient hasn't been able to get in to see you, then that's also going to send a message as well. And if you can give them another week's supply or a couple of weeks supply and work with the patient so that they're able to continue on their regimen, being supportive of a person that's sitting in front of you and helping them to navigate some of the challenges with staying on a PrEP regimen that may be otherwise challenging for them.
Yeah, thank you for sharing that. And I think it's uplifting what you said. It's important to be supportive. And then it sounds like you've listed or offered a few options, right? So there's some flexibility there too, right? There's a lot of flexibility around understanding where a young person is coming from and recognizing, I think what you've offered the most for this part of the podcast is that folks, providers, family members, community members, really providing a lens that is realistic, right? Mm-hmm. One that recognizes that some people forget, some people miss out. And, the whole purpose of care is ensuring that folks are reaching optimal care. And is it more helpful or harmful to offer or to be in discussions with young people around shame or continued support? Right. So thank you for offering that. And just to reflect again, we've gone over some community and provider perceptions, barriers, and strategies to facilitate PrEP based on the unique needs of young people. Are there any other questions, comments, or concerns you might have for folks around thinking about this work and access to PrEP for young people?
Yeah, I work in an academic medical center or setting, which fortunately takes care of a lot of different types of patients. But we also have to recognize that there are lots of places that don't have access to those type of settings and to academic institutions. Really being thoughtful about partnering with community organizations and increasing the capacity of providers in community-based settings to be able to provide access to these resources as well, I think is going to be super important. I am really a big advocate of primary care providers being able to provide these services. We know that youth are oftentimes in adolescence is the time when they fall off from seeing their pediatrician. But this could be a really good way of connecting back with primary care, ensuring that folks' sexual health as well as other aspects of their health are met in their medical home, and they're being provided with pre-exposure prophylaxis or HIV prevention tools. I think that's really, really critical to really making an impact and being able to provide PrEP and really lower the thresholds to PrEP for young people.
Yeah, that's a really great flag and hopefully a consideration for all places. And thank you also for outlining that where you're at your facility sounds like is well-resourced to do a lot of the work and really thinking about for other folks what might be needed or what other support systems can folks pull on to ensure that we're all doing our work and making sure that young people have the most optimum care if they can. So thank you so much for having this conversation with me. And I hope that folks that are listening are able to take away a few strategies in addition to thinking about some of the barriers around what it looks like to support young people in accessing PrEP. Thank you again.
Thank you so much. I appreciate having the conversation.
Thank you very much to our faculty, and thank you to our listeners for joining in. As a reminder to view the full program, Paths Forward in PrEP, Overcoming Barriers to PrEP Engagement in Principal Populations, head to the Clinical Care Options website. And to access more activities on this topic, click on the links in the show notes for this episode. Please be sure to check back regularly for more episodes on important infectious disease topics. Thank you and have a great day.